Claude Roy was born and raised in Quebec.
The decision to go into medicine was strongly influenced by family ties with the grandfathers and 3 uncles who were also in the profession. So I remember distinctly that as a youngster, I made rounds with my grandfather, who was a psychiatrist in Quebec City. And my other grandfather took me to his operating room, which was adjoining his office at the Ste-Justine Hospital in Quebec City. So I had not much choice but to go into medicine. And I salute their influence because this is a profession which I have loved all my life.
He's really one of the founders, godfathers, and spirits of pediatric gastroenterology.
There was no such thing as pediatric gastroenterology. There was no specialty. The specialty did not exist.
And then he not only became a pediatric gastroenterologist, but he formed the field.
Il a écrit avec le professeur Arnold Silverman de Denver, Colorado, le premier livre de gastroentérologie pédiatrique, ce que nous, entre guillemets, on considérait notre Bible.
Dr. Roy also was a powerful voice for the role and the place of clinician scientists, clinician researchers in the modern academic health centers.
He was always fully dedicated to research. However, for Dr. Roy, clinical practice, teaching, and research are all one, inseparable.
He's obviously a leader, but a leader with a clear vision of what has to be done.
Dr. Roy, c'est un joueur d'équipe, c'est un coach, c'est un capitaine, et il veut que tous ses joueurs donnent le maximum, mais évidemment, il prêche toujours par l'exemple.
He really brought the laboratory to understanding not only existing diseases and conditions related to the intestinal tract, but also in defining new areas never before defined.
That long tradition of the clinician scientist, there's no one more appropriate to represent those individuals, that class, than Dr. Roy.
He has trained more leaders in the field than I think anyone else I can name. And these people who are now leaders in gastroenterology are leaders in Canada, leaders in the United States, leaders in Switzerland, Belgium, France, worldwide.
Well, I wish someone had told me at the beginning of my career that I would still be seeing patients, teaching students, and doing research at the age of 84.
And it's really amazing that since his retirement, his so-called retirement, he's never retired and I don't think he will, he's continued to make major contributions in pediatric gastroenterology.
It's quite clear that the research virus has integrated into my genome, and it's an addiction and it's not curable.
Distinguished clinician scientist, renowned medical author, internationally recognized mentor, founder, and subspecialty pioneer. Ladies and gentlemen, Canadian Medical Hall of Fame laureate, Dr. Claude Roy.